morning, good afternoon, and good evening, ladies and gentlemen of ICRS. It's a great pleasure for us to start a new interview series, the Visionaries of Cartilage Repair from across the world. And I'm very glad that the work group on underrepresented region did a great search and we found out our first visionary. Our first visionary is from Mexico City, Mexico, and her name is Enel Alvarez Meza. She is an incredible woman, and I'm happy to introduce her to you in this first interview. Welcome, Anil. Welcome to the first interview series.
Hello, thank you very much for keeping me in the sight of this interview, and I'm very proud about this.
Thank you. Welcome, Anil. You have been selected as Visionaries of Cartilage Repair by ICRS. How do you feel about it? Do you feel excited?
Yes, of course. I felt very happy when I saw the email, and also very proud that the work I have done over several years has put me in the sights of the International Cartilage Repair Society.
True. And can you tell us more about yourself? How many years of cartilage repair practice you have been in?
Yeah, I have been in cartilage repair since 2007.
Mm-hmm.
I spent more than 1 year in Mayo Clinic in Chershov. Then I moved to Mexico to the orthopedic residency and started a master's degree. And finally, I did a fellowship program in arthroscopy and sports medicine injuries, and at the same time, a PhD in Mexico, which was very important complement for this career.
So what was the first case you did on cartilage repair and when?
It was in Mexico City, National Institute of Rehabilitation. When I was doing my fellowship program, we started to training a lot of scopes in knee surgeries, and especially in the line of autologous chondrocyte implantation. It was around 2012, 2013.
Okay, and so ACI was your first case?
Yeah.
So, I meet many people around the world and they say that microfracture was their first case, or mosaicoplasty was their first case, or they just did the debridement and chondropathy and that was their first case. But did you start with ACI first? That was a brave move.
Very cool, because in this hospital, the government used to give some grants for some big projects in this service. They used to work with autologous chondrocyte implantation, and they made it for about 40 cases, and the government paid for that.
Oh, that's incredible. So, Anil, tell me, did you face any obstacles when you started cartilage repair surgeries in Mexico?
Yeah, I think that to talk about cartilage, we have to talk about research. And this is a limited problem in Mexico, because this is an area that is still very limited for many professionals, especially in medicine in our country. For example, in Veracruz, if you want to do more different things, it's more difficult. You get more problems with people because you only have to do the basic things in the hospital.
True.
But when you move to big hospitals or institutes, the people who is around you usually push you to growth and to do more different things.
Yeah, I agree. I understand that many people who are cartilage surgeons and they are working in small cities and mid-sized cities, as you have worked in Veracruz, probably they have different challenges, and when they move to higher institutes, it's more or less smooth sailing, right?
Yeah.
But many ICRS members come from small cities and mid-sized cities. where the challenges may be same as Veracruz. So how did you overcome those challenges in Veracruz?
Yeah, first of all, I started the master degree over there in Veracruz.
Oh.
So it helped me to be closer to the research. But it was a difficult case because the people in my hospital where I was doing the residency program get like jealous about that resident is doing different things that a professor or a consultant is doing.
Okay.
So it was a very, very huge situation, give me more problems than recognizing.
Oh, I see. That brings me an interesting thought in my mind. Was the jealousy because you are a resident and doing new things? Or may I ask if the jealousy was because you were a woman or you are a woman? Or both?
Probably, but mainly because you are a younger person than they, and you are starting to do different things that probably put you in the scope of other institutions. But also to be a woman in the area of orthopedic is very difficult. When I
True.
started the orthopedic residency, we were 5 residents. 4 of them were men and only me women.
Oh, okay.
So it's a hard way in the area of orthopedics also.
I understand. So the challenges which you faced in your earlier days were like being young doctor who's trying to do new things and also a woman, right?
Yes.
So
Yeah.
so can you tell me, is that perception changed now? Mostly because of you are a woman and but in a bigger institute now?
Yeah, it's also different in a big institution because the concentration of students and the residents are different. They coming from different parts of the country, and it's more easy to find more women in the practice of orthopedics.
Anil, you must have had around, I guess I can understand, 14 years of practice in cartilage repair now.
Yeah.
And can you tell us the most challenging day you faced as a cartilage surgeon in your practice?
Yeah, well, this is a different
It's a
question.
difficult question, but
Difficult question because there's
I'm asking because many members face many problems,
yeah.
right? So they would like to
Um,
relate their problems that okay, the people also face similar problems as theirs.
yeah, it's a difficult question because there have been many difficult stages in my career, especially because of the pleasure I have of always doing different things, not out of competition, but out of curiosity to learn and innovate. So this has caused serious conflicts with professors due to professional jealousy, ending in complaints of workplace harassment. So,
Oh,
it's still difficult in the 20th century to be a woman in science.
I'm sure some parts definitely have that. So how could you overcome that? Or what drives you still to be a woman and a cartilage repair surgeon?
Yeah.
What is the driving force inside you?
Well, I have to be around of people who has the same interest and motivations as me, and it makes me to feel supported with different people who is working like me. So this is a motivation to follow up in this area. And also not only in my country, but also in in the meetings of different societies as the ICRS, where I have found a very recognized professor that have support me in this field.
And ICRS meetings are always driving you to do more better work in your own country, right?
Yes.
They are always stimulating for us.
Yeah.
So can you tell me, are you a private practitioner now or a professor, or you do both the things?
In the last 2 years, I have been only in private practice, although I have spent 8 years working at National Institute of Rehabilitation in the past.
Okay. Is it the same institute? I heard that years before you had applied as a fellowship program, some fourth residency program in the same institute, and someone sent you back that you have incomplete documents, and
Yes.
you just left that institute without arguing or discussing with those guys, and then the same institute invited you after many, many years to be the professor?
Yes, it's the same one. It's a curiosity, but that's true. It was the same that in the beginning closed me the doors. And then many years later, immediately that I finished my residency, my fellowship program, they hired me to work as a consultant in the hospital, as a researcher, and also a professor for the courses.
So how did you felt on that day? If I would be you, I will feel very happy that, okay, you shut your doors on me and now I'm coming back as a professor. So how did you feel on that day?
Well, I felt very proud about me because I have thought that the things happen for something. And probably in that time, it was not my place to be there.
True.
And probably I had the others of better opportunities as go to Mayo Clinic before to go to this hospital, and always the things happen for some reason.
For a reason, right? So I totally agree with you that probably that was not the time you should be in that institute, and then you created a place for yourself, and that's an important message I get, that if there is a adversity, it creates opportunity for you. It opens many, many doors for you, isn't it?
Yes, of course.
Yeah. I also found out, because we did some research about you, that you have 3 patents on your name. Can you tell us more about those patents?
Yeah, I have 3 patents. 2 of them are about the biomechanical analysis for resistance of tendons. These were an invitation of biomechanical laboratory in the National Institute of Rehabilitation. But the one that is very important for me is the allogenic chondrocyte implantation. I'm looking for the patent in Mexico and in the US. And it's a hard topic because it's not easy to get a patent. It's a little bit different than to do only research. Most of them, because all the paperwork that you have to do, the information that is reviewed for the government and for the development of technology, but we are working in that.
All right. And I could see that you isolated stem cells from synovial membrane, you isolated stem cells from Hoffa's fat pad, and also, as you said, from allogenic stem cells. So I could see that you are trying to convert stem cells from synovial membrane, Hoffa's fat pad, and allogenic. So according to you, which cell is the best out of these 3?
Okay. Well, I think it is simple. If you want to generate hyaline-like cartilage, you have to use the machinery that expresses the same markers as native cartilage.
True.
But the limitation that has led to the search for other types of cells, such stem cells, is the small number of chondrocytes that can be isolated from autologous donor. But if you have a similar alternative source with less morbidities, unlimited and well-differentiated cells, the idea is to follow that line. So I believe in chondrocytes, even autologous or allogenic, that we are looking this line for now.
There was also one paper on, you have done a study on the role of hypoxia on differentiation of human chondrocytes. Tell us more about that.
Yes, of course. In the National Institute of Rehabilitation, there's a specific laboratory focused in synovial fluid and cartilage. So this is a paper that we published in Cells Journal in 2022. We know that preservation of chondrocytes phenotype is an important factor in the production of hyaline cartilage-specific proteins. The cartilage is a tissue with a low metabolism, this is known, avascular, and therefore hypoxic activity. So most research models in chondrocyte culture handle two-dimensional environments and normoxia conditions. So we work on that because we thought that the generation of 3D cultures under hypoxic conditions has significantly favored the expressions of native proteins or proteins characteristics of hyaline cartilage, as SOX9, ACAN, collagen type 2, compared to those projects that are using two-dimension cultures and under normoxic conditions that are not recreate the conditions of native cartilage.
I could see that you also have interest in cadmium toxicity on cells.
Yeah.
You had some papers. So how did you got interest in cadmium?
Well, cadmium is a very interesting topic because we know that this is a highly toxic metal to which human beings are exposed through different sources, not only in the tobacco, but also as batteries, as contaminated food, like cereals. So the accumulation of cadmium in tissues has been related to the development of joint diseases by promoting the destruction of cartilage. So we also know that osteoarthritis is one of the most prevalent diseases in the world, and we know that this is a multifactorial disease. And has been described that smoking, that is very related with cadmium, is one of the factors that contributes to this disease.
So could you compare the group who is a smoker and osteoarthritis versus a group who is a non-smoker and had osteoarthritis?
No, it was only a basic laboratory study for the behavior of the exposition of the chondrocytes at this metal, but we didn't do this comparison in humans in a clinical trial.
Okay. So can you tell us something about your mentors in brief?
Yes, of course. Especially I have 3 mentors in my life in cartilage. First of all, during my social service at the National Institute of Nutrition in Mexico City, Dr. Jose Antonio Collar Puente, thanks to him, I spent 1 year in Mayo Clinic. He was the bridge of the Mexico to move to Rochester, Minnesota in Mayo Clinic, and later at the end of the specialty at the National Institute of Rehabilitation, when I go back to this hospital as a fellow, Dr. Clemente Ibarra, who was the chief of the arthroscopy service, gave me the opportunity to do the fellowship in arthroscopy and sports injuries and the PhD program at the same time. And of course, many clinical projects in the cartilage field in this fellowship. And finally, during my continued attendances at international conference, I met and I know Professor Mats Bridberg, who has been a source of immense inspiration, not only professionally.
For many people, isn't it? For around the world.
Yeah.
Mats is a gem of a person.
It's an icon of the cartilage and also orthopedics. So he has been a source of immense inspiration, not only professionally, but also personally. He's an excellent human being. He is not only my teacher and mentor, but also has been a great friend for me. Those are the three people who are very important.
Right. So, NL Olivas Meza, 2010 and 2024. What difference do you see in yourself?
Well, it's a huge difference because my first time that I was out of Mexico was in 2007 when I moved to Mayo Clinic in Rochester, and it was very difficult because to be in a different country with different language, with any idea of research. So for me, it was very difficult to adapt to the process of the clinic. After a few months, I fortunately get the rhythm of the clinic, and they asked me before to stay for more time, and they paid me to stay over there.
That makes life easy, isn't it?
Yes, yes. The most important for me now is to be considered a leading reference in Mexico and Latin America in the area of cartilage as an orthopedic surgeon, professor, and researcher. And of course, to be for now, in this moment, to be in the sites of the ICRS. It is a big difference for me, and it's a very important goal for me.
Where do you see yourself in 2030?
2030. I don't know.
What you want to be next, maybe 10 years, okay?
Well, I am very exciting for this crazy topic of allogenic chondrocytes, and I believe that it could be a treatment of reference around the world. And my goal in some years is to show this technique to different professors around the world, and the professors and doctors that are in the field of cartilage repair could reproduce this technique, and to be a leader as Dr. Lars Peterson and Dr. Mats Bridberg are now in this.
That's quite encouraging to learn.
Yeah.
That's quite encouraging to learn.
Yeah.
Where do you go to relax? Where do you go to chill? What you do when you want to be away from your profession? What you like to do?
When I have time, I like to spend time in extreme sports. I like extreme sports.
Oh, that's
but
news.
Also to have time with my family, with my friends. I like to travel. I like to play the guitar. So
no, that's lovely.
Yeah.
So what extreme sports you play?
Well, I like the bungee jumping. I used to go to river rafting and climbing.
So you're not afraid of heights. You're not afraid of heights.
No, if I'm not afraid from cartilage, I'm not afraid.
That's a good one.
I had a meniscus tear in my knee.
Oh my God.
My right knee.
And who did operate? Did you get it operated?
No, for now I'm doing rehabilitation.
Your patients are listening, don't
I'm looking for a good cartilage surgeon.
Sure, I'm sure. Anil, I really found you as a very, very brave woman who had who had brought all the odds against a young surgeon, odds against a woman, and odds against a person who tries to bring a change. And you were successful in removing all those odds from your life. Not only you removed those odds from your life, but you contributed a lot to the fellowship program. You did good research activities in your country. Then you found out new ways to improvise the cartilage repair technique in your country. And truly, you have brought a change in Mexico. It was real pleasure interviewing you. I wish you all the best for your life, and we want to see you reach more heights and reach your goals. And we want to see you coming back to ICRS meetings and meet
Yes,
you
of
in
course.
person. And
Yes, of course.
I'm sure after this interview, many members of ICRS would love to meet you in person during next ICRS meeting.
Thank you very much. Of course, we will meet in person in the next ICRS course.
All the best.
Thank you very much for you, for the ICRS, and for all the professors that have been support my career, not only in Mexico, but also friends out of Mexico. And I'm very proud to continue in this, growing in this field.
So, ladies and gentlemen, we heard Enel Olivos Meza from Mexico, who is incredibly talented and has worked hard not only to improve cartilage repair and joint preservation surgery in her country, but she has tried to do many research activities. She contributed, she patented few techniques, she published many research papers, and she has wrote many chapters in cartilage books. She had been, I can say, an icon in her own country, while she has many icons around the world. And she has been running many fellowship programs, and she has encouraged many young surgeons to do to take up the cartilage repair and joint preservation as a challenge and to improve people's life in her country and in her region. So we are really proud of her, and she is truly an ICRS cartilage visionary. Next month, we are going to bring another visionary from another part of the world. Stay tuned to ICRS. Thank you very much.